Well, joining me now for a chat is Dr. George Ebong. He's the president, Resident Doctors Abuja chapter. You saw him in those previous reports. Thank you so much for joining us on Newsnight.
Thank you very much.
You know, just like Americans appreciate soldiers each time they, come across them and just appreciate what they do, I want to appreciate what you doctors do in spite of the really tedious conditions that you have to work under. When you consider that is one medical doctor to 9,000 patients in Nigeria, contrary to what the global standard is. Let's start from there. I mean, this strike, has it achieved anything at all?
Yes, thank you once again. Yeah, it has actually achieved the awareness we wanted to create. We wanted the minister to know that we've got a lot of trouble in the healthcare system. And we felt, or we believe that the minister actually has been shielded from the things that he should know. And so we had to create this awareness because we have always thought that if he knew, he would do something. And so now that he has done something by doing the approvals, is because he has got to know. Yes, we were told, even by the minister, that he's approved that employment should start. We're told that he's also approved that the doctors that were owed, especially the 28 doctors that have been owed for like a year, 2 years, that they should be paid.
Right.
And we're told that he had said that those that should be promoted, things that will make doctors to stay back and work. And of course, it's also approved that they should look into fixing the healthcare system. So those are the things we wanted him to do. But all along, I think somebody has been blocking him from getting this information. And now that he's aware, he has started something. So we thank him for that.
Well, I mean, the FCT minister will be happy to hear you say, because I heard you say in that report that you are confident that he will fix, the challenges that you've been facing in the FCT health sector. Now, he says he has signed off on all your demands. Right. And you're confirming that now. But you do understand it's one thing for that approval to happen. It's another thing for that to be implemented. Is there a timeline for these demands to be met based on his signing off on them?
Yes, yeah, we do have a timeline, and that was why we suspended.
Okay, it's a suspension.
Absolutely.
Right.
And this happened because we had to talk to some people in the National Assembly. Well, let me thank Senator Dr. Ipali Bohari Banigo, the chairman of the Senate Committee on Health, and of course, Senator Dr. S.U. Jim Kuta, the chairman on the Senate Committee on Federal Territory, Area Council, and Ancillary Matters, and all the members, because they actually had an emergency hearing with us.
Right.
And they said they were going to intervene. So we had even suspended before we heard that the minister had approved those things. And now that he has approved them, we will make sure that we follow it up and get back to the minister on any of those approvals that are not actually being implemented, especially the 28 doctors that are being owed. Right. We are going to make sure that we follow it up. The employment, we're going to make sure we follow it up, and we're going to make sure that we report back to him, even directly this time around.
Now, listening to Olije Wapera's report on the state of healthcare and health facilities in the FCT, I mean, I'm sure every Nigerian want to pray not to fall sick, because, I mean, those conditions leave much to be desired.
That's
and
right.
While that report was going on, you were even telling me that the situation is even worse than what we're seeing, in Olije's report there. Paint a picture of the dire situation that FCT hospitals are in.
All right, so let me start with like the Nyanya hospital that you showed.
That was, yes.
So you have like an average of 15,000 patients you see a day, or a month, sorry.
15,000.
Yes, and then you have only 20 doctors to see them. And then you have a bed space of just 39 bed space of 40 maximum. And that hospital has, that hospital caters mainly for pregnant women and children. So you really have like more cesarean sessions for those women who may not have what you call normal delivery, right? And you can have a doctor do up to 9 cesarean sections, even 11 in a day.
One
That's correct.
One doctor
That is correct.
can carry out 11
yes.
Caesarean sections in one day.
Yes.
What's the ideal? What's the ideal?
I mean, you shouldn't do more than 2.
Oh my.
Yeah. So if a doctor is doing 11, 10, then how do you prevent unnecessary mortality? How do you prevent that? Or you go to some other hospitals where a doctor takes shifts in a call in all the 4 major departments. So these things are not realistic. And so you see doctors collapsing at work. You see doctors dying, like the case we had in Port Harcourt. You see doctors on self-medication, on antidepressants.
Oh, yeah.
You see doctors hypertensive and medication. So these are not just good for us. And not even, in fact, we're actually practicing quackery on our patient with this kind of condition.
No, I need you to stress that point.
I said, in fact,
what exactly does it mean? As in medical doctors who are well trained,
right,
well certified,
absolutely,
are practicing quackery.
That's correct. Because of lack of manpower. So that's quackery actually. When you're doing 11 Caesarean section, that's quackery already. Maybe that's quackery already, because you don't even have the time to recover
before you get to the next one.
Absolutely, yes. And there are other things as well, so that's not nice, that's not good.
You know, in May of this year, a House of Reps actually warned that FCT hospitals were on the brink of collapse. I mean, that in itself is comforting. But beyond raising the alarm that, look, something needs to be done urgently with FCT hospitals, have they, I mean, they actually said they were going to set up a committee, you know, to go around and take a look at these hospitals to know how bad things are and to know where to begin to fix them. Right. Has that even happened since May that they've raised this, you know, alarm?
I think, yeah, they did, and I think they got their report.
Right.
Well, you know, I heard when the minister said something like probably some people were instigating us. No, nobody.
Yeah, to blackmail. He actually used the word blackmail.
Yeah, nobody's instigating us. It's because we believe that he can do something. I mean, this is the same man that has turned Abuja around in less than 2 years. Right. So we believe he can, if he's really intentional, if he knows what is happening, he can fix the healthcare. We don't want to lose that chance. Once we lose him there, then we don't know who else is going to have the zeal to want to fix it. So once he's still our minister, we're going to make sure that he does what he needs to do.
Well, that's a challenge to the FCT minister, and it definitely looks like he's ready to take you up on it. Now, I'm a bit curious. When I heard that, you know, resident doctors had called off the strike, I was happy, but to hear that doctors will not resume until Monday, and I'm imagining, what about the, you know, the backlog of emergency cases in the course of the strike, and even this weekend? I mean, one can only imagine. Can emergencies wait? Why, you know, why are the doctors not resuming immediately, and why till Monday?
Yes, because we're trying to retransition our patient back to the hospitals. I mean, some of them, or most of them, we had to transition them to other hospitals, and so we're trying to bring them back to our hospitals. So we've done the medical calculation, and we see that by Monday, 8 o'clock, we'll be able to like fix all the things we need to fix before they come in.
Dr. George Ebong, thank you very much for what you do in spite of the dire conditions. You're the president, Resident Doctors Abuja chapter. Thank you very much for joining us on Newsline. Feel free to come back and let us know if your demands have begun to be met, especially with the FCT minister promising that he signed off on your demands.
Thank you very much.